Okay, so I'm joined now by Councillor Eleanor Wills, who's joined us today to talk about Tameside's vaccine rollout and how it's going. So first of all, welcome, Councillor. Thank you for joining us.
Thanks very much. Thanks for inviting me along.
So do you want to give us a quick update on where we are with the vaccine rollout in Tameside? Because I know early on in the year we were doing very well, weren't we? Where are we at now?
So currently we've done just over 64% of all adults in Tameside and Glossop have had their first vaccine, and that equates to around 128,000 adults that have had the first dose of the vaccine, which is really good. We've done really well with it.
That's a fantastic number. Yeah, compared to nationally, where are we at?
We're surpassing the national targets at the moment, which is great, especially with regards to our clinically extremely vulnerable and those at risk. We've surpassed the national targets.
That's great news. So like you say, we have moved from the older generations sort of into the younger generations now. What's the uptake been like with the younger generations?
It's a little bit slower from the over 50s, which is obviously a reason why we need to continue to push and remind people that when they do get invited for the vaccine to take that offer. We're doing all that we can to kind of try and promote that, hence obviously me speaking today, but we've done lots of accessible clinics throughout local areas, as well as some of the pop-up clinics. We ran one on Saturday in Droylsden recently. We've done a couple in the mosques in Ashton, and looking to do one in the mosque in Hyde as well. So we're trying to make it as accessible for people as we can locally as well.
I was going to pick up on those like pop-up centres. Have they been really successful in getting younger people especially to take up the vaccine, being able to just drop in whenever they want?
Yeah, and I think it's really important. I mean, just trying to appeal to harder to reach communities as well, to be honest. And I think it's easier if it's more sort of in your face, if you like, and then it kind of prompts you to act, doesn't it? I know in Stalybridge we're looking at having a couple of pop-up clinics, and at the start of early June we're going to have the vaccine bus. So we're going to look at running those sort of central to Ashton, Stalybridge and a few other town centres where we can.
How will the vaccine bus work? Will that be one that travels around?
It will be stagnant on the day, but it will travel around from town to town. I think we've got it for a 2-week period.
So it's more important than ever, isn't it? Especially with the emergence of these new variants, that people do get vaccinated, because that's the best way to prevent against being seriously hospitalised by the virus. Is there a problem in Tameside with the Indian variant, or would you make sure that everyone gets vaccinated? What's the council's message?
So the message at the moment is we're not invulnerable to the new variants that are coming through. We are seeing new variants come through. They're not the monopoly at the moment, but obviously it does make it more poignant to kind of remind people to go out and get the vaccine. If we look at other neighbouring localities that have had the new variants and their hospital admissions, it's generally people that have been offered the vaccine that haven't taken the offer, that have ended up kind of at the worst end of the scale in terms of illness. So it's really important if we can prompt people as much as possible when they're offered to go out and take the vaccine up. We're also bringing the second vaccine forward as well, whereas it was advised for 12 weeks and then 11 weeks. We're now bringing it forward to 8 weeks. So people will start to see that the second appointments are coming through earlier than they'd expected.
Absolutely. That's fantastic news then, getting people up to full protection as soon as we can. Just finally, currently, who is eligible to get the vaccine now? What's the latest on that? And if anyone wants any more information, where can they go to find it?
So it's anybody over 35 is currently eligible. But what I would say is, if you deem yourself to have any vulnerability, even if it's not currently acknowledged through your GP, make yourself known and bring yourself forward. You can go on the NHS website, or you can go on our local website, which is Tameside and Glossop NHS vaccinations. Just to say, we are seeing currently at the moment a slowdown in infection rates within our care homes at the moment, and I am touching wood, we don't have any infections from COVID running through any of our care homes in Tameside at the moment. And I do think that's a lot to do with the fact that they have received the first vaccine earliest, and they've also now received their second, and that is showing significantly the reduction in infections within those care homes. I think that's hopefully going to mirror the picture. The more people within the communities that go out there and get the vaccine further down the line in terms of months will be in the same sort of position where transmissions at an all-time low.
Absolutely, that's fantastic news that the most vulnerable across Tameside are protected now, and hopefully, like you say, it'll mirror the national picture. Councillor Wills, thank you very much.